In 2008, Bradford City Council became one of 21 Pathfinder councils to receive funding from the government's transformation programme, aiming high for disabled children. The allocation for the district was just under £5.2 million. £140,000 of this was carved out for a brand new scheme to train and empower a group of young people with severe and complex health needs. The group would become known as Bradford's Peer Champions.
The main role of the peer champion will be to go out into groups within the community and raise awareness in terms of rights, and also hear what other people have to say and what their issues are, up to commissioners and people that plan services, and to make sure that their voices are heard.
To do this, the young people need to be trained, and today they're making a start. The peer champions are designing individualised logos for sweatshirts. They're aimed at identifying the peer champions as individuals within a recognised group, and they'll be used when visiting other groups.
You know what you can do on your sweatshirt? I've got these pastels, wait here a second, I'm going to get them.
We've got problems in terms of people's attitudes to them, how the young people are going to be received, and protecting them from any discrimination, either directly or indirectly, that might come. We don't want that to happen. It's about making sure that them ideas are able to be implemented in the best interests of the young people, and not just because it's an idea that somebody's had.
As an established expert in the area, Bernardo's Seen and Heard was approached to set up and oversee the training of the young people.
When we were considering how to really develop a participation service, we were obviously very keen to have people who know how to work with young people. But equally, we were also quite interested in the fact that Bernardo's, as an organisation, were doing similar work in terms of participation work with adults, i.e. the parents and carers.
Key staff with an experience of participation work with young people needed to be recruited, and quickly.
One of the first challenges we had, given that we were commissioned to deliver this service, is actually recruiting the staff to do it. Even the interview at that point involved the young people. So it involved children with disabilities. We got a panel together and I had to do some work with them to go through what the job spec was and to ask them what they felt was important for worker who were going to support them through this work.
We've got a wide range of abilities and special needs across the children that we're working with, and we need to be as inclusive as we possibly can, so we need to enable all the children to have their input into our processes. So quite a multi-skilled team that we were looking to put together, but we were lucky to find people with those skills.
Newly appointed staff approached specialist and mainstream schools in the area, appealing to students to apply for the chance to become a peer champion. The aim? To get the voices of disabled young people heard by those commissioning and delivering services.
The peer champions had to prepare and deliver a 1-minute presentation. We weren't looking for super confident people, but people who eventually would feel confident in going out to other settings and meeting other young people.
A similar training course already existed, but was aimed at adults with learning difficulties. The approach needed to be revised if it was going to appeal to teenagers with a shorter attention span and varying ranges of communication needs.
We've got some young people that have autism. We've got a young person with cerebral palsy, and a young person that uses a wheelchair as a physical disability, and some young people with learning disabilities. You've got different communication needs, and that takes a lot of work and preparation to make sure that that young person's got access to their preferred method of communication. So you're not imposing a method that works for all onto them, so they can express themselves as individuals, really.
Samina Tariq, a participation worker for Bernardo's, redesigned the existing adult course and used it to train the young people in preparation for their work in the community.
One of the concerns for myself was, are we putting these young people in a situation where we're reinforcing a kind of very tragic view of disabled children and young people, where they go in and, oh wow, aren't they wonderful kind of thing, and how brave are they to come here and talk about their issues. And what we want to do was not reinforce a very stigmatised role for disabled young people. One of the requirements of the course is that it's delivered by a disabled person. So what they get is, you know, role models, disabled adults who are able to challenge them maybe in a way that a non-disabled person isn't. You're able to joke with them. We make it okay to be disabled, to be and to accept impairment as another form of their identity rather than something they need to be ashamed of or, shy away from.
While Samina planned the training course, other staff within the team concentrated on the logistics.
Each child has to have a healthcare plan which looks at all of the needs, including moving and handling needs. If they are a wheelchair user and might need assistance in terms of going to the toilet or special equipment or adaptations. It also looks at health, medical consent, photographic consent, communication and behavioural aspects as well. Some very obvious difficulties when accessing buildings about is it disability accessible? Because even though we've got Disability Discrimination Act, it's not every building is compliant as yet, so we've still got them physical challenges. We've got problem of transport and how expensive taxis are for children with disabilities. And it's not like you or I getting a taxi 10 miles down the road. The prices can often be doubled for children with disabilities.
The training sessions aimed at improving services for disabled young people by giving them an input into their design required the young people to examine themselves and the way some people in society may view them.
One of the biggest things that I find disabled young people do not want to accept that. They don't openly say, yes, I'm a disabled person, which I can empathise because growing up it was not a word that I like to use because to me at that point it meant, and as it does for a lot of our young people today, it means some kind of personal inadequacy. I think that has a lot of impact on disabled young people's lives growing up. It means you're not likely to value yourself. You're not likely, when you go to schools, colleges, or when you're out and about, to challenge people's attitudes towards you if you're going to be thinking in the medical way. Whereas the social approach kind of turns it on the head, really. It sees disability not as a personal, tragic issue that you need to deal with by yourself or your family needs to deal with. It kind of turns on its head and it sees disability as an equality issue.
What would be some of the things that you might want to take out to them that you think would support them?
They have the right to speak up about their own opinions, that they have the right to have their own opinion.
Damien, you just said something a few minutes ago.
Making fun of people, like me.
Yeah, making fun of people.
Because I was in a wheelchair. People used to torment me and wind me up and touch my controls and stuff. So when I told the teachers, they didn't really do anything, so...
Each training session was planned and data recorded to form a framework of each member's progress that could be analysed throughout the training period.
For every session, there'll be a detailed session plan and there'll be the objectives for that session. And evaluation at the end, both from the young people and from the people working on the session. So all that then gets fed into our quarterly returns, so you can learn as you go along. We have to be reactive as well. So we've got the proactive approach prior to the work starting, but then we need to be, if we need to change course in the middle, then we need to know what we need to do.
Although difficult to quantify the success of the project at this stage, staff at Bradford are positive about the scheme's results and, importantly, its process and how that affects young people.
A member of staff will notice a massive change in self-esteem for a young person, but quantifying that and getting that down into a written report, these results don't fit easily into boxes. And they don't exist in a laboratory, so we can't measure them like that.
Well, I think the first measure of success is if young people have continued with the programme, because young people vote with their feet. Any young person does. If it's something that they're not wanting to do or they don't feel they're getting anything out of it, they'll go somewhere else. I'm hoping that the real message is that to them is that actually we value their input. And if we can do it at this stage when they're young people, then these are the people in the future who are going to be informing policy.
But now we're lifting their heads up and they're having more of a presence, and that says to me that that's helping their self-esteem and that they're feeling more important and that they're valued.
The peer champions will face a range of complex communication needs when they begin work in the community, visiting other groups.
It's my job to make sure that that's meaningful participation and that they get heard at a higher level, which is why I attend the Aiming High steering group and feedback the young people's views and make sure people from that group come and listen to them directly and that their views are considered and acted upon rather than it being a token gesture.
They're going to go out to a group with visual impairment, so that'll be a really big communication need to address around maybe the use of Braille. I suppose for communication, understanding communication needs and supporting them, for me, is the foundation of participation. That if you haven't addressed the communication needs, there's going to be no consultation, there's going to be no participation of those groups. It's absolutely the foundation stone.
The project's been both a steep and a tough learning curve for staff.
There isn't a set criteria for this. We are developing it as we go along, but what we won't do is expect them young people to go out and muddle the way through a participation session with young people, because that's not fair to them or the young people, and it won't allow them to communicate their views.
I think even we underestimated the amount of preparation time that it would take developing the work and the planning for the young people, because of the different needs and the levels of support the young people required.
It takes a lot of planning, a lot of hard work. You know, the staff that I work with work all day, every day, Monday to Friday, and above that, they do weekend work sometimes, and they work quite late into the evenings. They're very committed.
We've got a lot of evidence to say that if families and young people are involved in helping us design the services, those are the services that will work.
OK, looking back then, before the training, what other ways did you not perhaps feel confident?
Nerves.
So you used to feel nervous?
Yeah.
Doesn't everybody have the right to speak?
Yeah, to be heard.
I think that's more to the point, isn't it? To be heard. Everyone can speak, not everybody's heard though.
The Peer Champions Rap is a light-hearted way of informing other groups who they are and what they do.
Freedom is a right that everyone should get. We all have the right to have our needs met. I love my mum and dad very, very much. I try my very best to try and keep in touch. We do not get on all of the time. What's the problem with that? It's not really a crime. I like to hang with my brother, but stay with my mother. Which one should I stay with, one or t'other? Coming to the end of this rap song, I stay with my family, that's where I belong, yo.